Okay, welcome everyone to our January 20th, 2021 City Council meeting. I'd like to call the meeting to order and request that our clerk read the roll, please.
Vice Mayor Bruce Haddishelt.
Here.
Councilmember Albert.
I'm here.
Councilmember Rakucci. Here. Councilmember Mendonza.
Here.
And Mayor Bernasconi.
Here, thank you. I would now like to lead us in the Pledge of Allegiance. Salute, pledge.
To the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and
justice for all. Thank you. Can our clerk please read the meeting procedures?
Good evening. Pursuant to the executive order executed by the Governor of California and in a response to mitigating the spread of COVID-19, the meeting of the City Council will allow members of the public to participate and address the City Council during this meeting. There are two ways to accomplish this. Public comment may be submitted by telephone during the meeting and prior to the close of public hearing on an agenda item by calling 916-774-5353. If you call, you may be placed on a brief hold until the attendant can answer. The broadcast is delayed by up to 30 seconds when watching at home. When your call is transferred to the City Council, you will have 5 minutes in which to speak to a regular agenda item and 3 minutes for public comment on items not on the agenda. I will monitor your time and let you know when your time has expired. When calling, please do not use the speakerphone option as it may create difficulty for the City Council to hear your comments. Public comment will also be accepted by email at publiccomment@roseville.ca.us. Comments received by email will be summarized by general topic and will be made part of the meeting record. Thank you.
Thank you very much. We will begin with item 5.1, which is a update on the response to COVID. And I'd like to ask our city manager to begin the presentation.
Good evening, Mayor and members of the Council. Thank you. I'm pleased to be here this evening. I will not be providing our typical COVID-19 update response. Tonight, we're very fortunate to have Dr. Rob Oldham, who is fairly new to this role. He's certainly been in the area for a long time. Dr. Oldham is not only our Director of Health and Human Services, but he's also our interim health officer. With all the questions around vaccine and vaccine rollout, we thought this was very timely, and we're really pleased to have him and members of his team here from Placer County to provide the update and absolutely stand for any questions that we get from the council or from members of the community. I will be here as well. And again, I'd like to thank him and his team for being here this evening. And without further ado, I will turn it over to Dr. Oldham.
Great. Thanks, Dom. And thanks, Mayor Bernasconi and council members. And I appreciate the invitation to provide a brief update to your council on Placer County's HHS response to the COVID pandemic. I just, as Dom said, returned to Placer County Health and Human Services about 4 months ago after working for a while for Sutter Health. And I regret to admit that in my previous 5.5-year stint as Placer County Health Officer and Public Health Director, I never actually addressed this council. So I guess one of the silver linings of this pandemic has been that it's made it just imperative that we improve our collaboration and communication. The city of Roseville has over a third of Placer County's population. Sometimes we make distinctions between county and city government, and I guess those distinctions can be important at times. But when it comes to health and human services, we are Roseville's health department. We've enjoyed great partnerships and relationships between the city of Roseville and Placer County Health and Human Services over the years, and especially during this pandemic. And we're committed to even closer collaboration going forward. In fact, we would be delighted to return at any time in the future to provide additional COVID updates. And in addition to COVID updates, we'd also love to provide your council with more general overview of our department and any particular programs or issues you'd like to hear more about. We're proud of the work that our 6 divisions are doing and more than 800 employees doing to help build a healthier Placer County together. A lot of that work is happening in and around Roseville, and we would love to share more about that work and get regular input from this council and the residents you represent. So with that, this evening, I will provide your council with a brief update on COVID-related data and metrics, and then I'll hand off to our public health manager, Mike Romero, who will talk about the topic that everyone seems to want to hear more about, our COVID vaccine distribution. See, the slides are up, so you can move on to the next slide, please. And this slide shows our testing positivity rate over time, which is the percent of the tests that are sent to a lab that come back positive. The bad news is that our current testing positivity rate, as you'll see here on the graph, is about the highest it's ever been, and indicates that we have widespread community transmission here in Placer County. The good news is that this number has not really gone up dramatically in the last month, indicating that perhaps the spread of COVID in our community has begun to plateau, albeit still at a very high level. Next slide, please. So similarly, this slide shows that the level of hospitalizations due to COVID also seems to be coming down a bit. But again, hospitalizations remain at a very high level. Next slide, please. There's been a lot of attention on ICU bed capacity, particularly as it relates to as a trigger for the regional stay-at-home orders. ICU bed capacity is a little less standardized than some of the other metrics that we track, and so it's a little harder to derive meaning from exactly what the numbers mean when we look at these. We do know that our hospitals are often treating patients who are very sick in their general acute care beds now. So many of these patients probably would have been admitted to the ICU 6 months or a year ago, but now are being treated in general acute care beds instead. So it's a little tough to make meaningful comparisons, ICU numbers over time. But I do think it's safe to say that our ICUs in particular and our critical care bed capacity in general is stretched about as much as it ever has been, with no real immediate relief in sight. Next slide, please. Here is an even more somber slide that looks at the number of deaths due to COVID by month. As you can see, we saw 3 times as many deaths from COVID in December as in November, which was previously the month with the most deaths in this pandemic. And unfortunately, when we look at January, the data shows that we're probably on track to have more deaths from COVID in January than in December. Next slide, please. This slide is to remind us of the state's COVID tier framework and where Placer now falls on that framework. We stopped talking so much about some of these metrics while we were under the regional stay-at-home order, but now that we're no longer under that regional stay-at-home order, we're back in the purple tier, which is the most restrictive tier in the framework, the one that doesn't allow things like indoor dining. But as we're coming off, I think we're going to get more questions about that. People are asking me, when are we going to go to the red tier, for instance, which is the next least restrictive tier. You can look at the numbers here to say, although we're in purple, I guess we're in deep purple. So our adjusted case rate and testing positivity rate are still very high and probably going to be quite a bit longer that will be here in the purple tier. But hopefully we can prevent from going back into a regional stay-at-home order again. And then before I hand off, you can bring the slides down. Before I hand off to Mike to talk about vaccinations, I just want to take the opportunity to call attention to really the heroic work of our healthcare workers in responding to this pandemic. They were already, prior to the pandemic, stretched very thin with historic shortages and levels of burnout. But this pandemic has forced them to continually adjust and sacrifice really over the last 10 months or more with physically and emotionally draining work days and very few days off. So we just can't thank our healthcare workers enough. If you ask them how we can thank them, most don't care too much about kudos. They just ask us to take simple steps to avoid overwhelming them with very sick patients. So remember to mask up, wash your hands, keep your distance, and avoid gatherings as much as possible. And with that, I will you can take down my slides, and I will hand off to Mike Romero, who's going to talk more about vaccination. So I guess you can bring up the slide.
Yeah, bring up the slides again. Thanks, Rob.
Thanks, Mike.
So it's really nice to be here as a Roseville resident myself. Our response for us started in mid-February, tracking travelers from China, and it's amazing to think that 11 months later, we're focusing on vaccine, which is really the public health dream in dealing with the virus. So we got our vaccine in December, and we're following the state's framework of how to prioritize folks for vaccination. The slide here shows a nice graphic of what that framework looks like. We're in phase 1A, which is primarily healthcare, with a lot of subgroups of healthcare. And because of the rate at which we were moving through phase 1A, we were able to open tier 1, 2, and 3. So we are here in the latter part of January, focusing on all 3 tiers in phase 1A. We get a lot of questions about when are we moving to the next phase, phase 1B. It's really hard. It's really hard to determine because we're not getting a regular allocation of vaccine. No one is, not a predictable allocation. One of the changes since we developed this slide just last week was that opening up to 65 and older. And so that's part of 1B. That's exciting for us because of the risk of mortality to the over 65 population. It also makes getting an appointment very challenging with that many more people trying to fill relatively limited numbers of slots. So we're going to be in phase 1A for a while. We're going to be supporting 65 and older for a while. This framework that you see is also likely to change. The governor's office throughout the COVID response has recognized the need to adjust. And so don't be surprised if you see adjustments to these phases as well. Next slide, please. So how are we addressing the vaccine administration and distribution in our county? So there's a lot. The first thing is to have partnerships, right? There's nothing about COVID that any of us does alone. You can see from this graphic that these are the different groups so far that we're working with. The tier 1 of phase 1A started with the hospitals, the 3 hospitals in Placer County, plus Tahoe Forest Health System up in Truckee, as they serve the North Tahoe community as well. So they started off vaccinating their employees. They're on their second doses right now. A few clinics like Chappaday and Western Sierra Medical Clinic have also vaccinated their staff and are looking for opportunities to vaccinate their patients as well. One of the partnerships that we're very proud of is with the pharmacy community. CVS and Walgreens are busy vaccinating all the long-term care facilities in Placer County, skilled nursing, assisted living, and the residential care facilities. That's a lot of facilities. And CVS and Walgreens, this is a federal partnership, but these are mobile clinics, and the logistics of doing mobile clinics is extraordinary when you consider the number of facilities that are impacted. In Roseville alone, there's a fair number of skilled nursing, assisted living, and residential care facilities. So this partnership is imperative to reach those who are most vulnerable. We don't normally see the numbers from these. It's hard to track when they've gone to certain locations, how many people they've vaccinated, et cetera. But this is a huge lift from these 2 big pharmaceutical retailers, right? And we certainly appreciate that. We're also proud of our partnership with Safeway. Safeway has 8 pharmacies from Lincoln to Kings Beach, and they are vaccinating folks Monday through Friday. And it's an important partnership because it gives us geographic distribution, giving people an opportunity to get vaccinated from their neighborhood pharmacy. We expect other pharmacies to join this. We're in communication with SafeMart and Walmart, so look for those relatively soon. And of course, we have our clinic at the grounds in Roseville. We're very proud of that location, the partnership with the team at Placer Valley Tourism, David Attaway and his team. It's a premier location for events like this. We have responded to emergencies there before, and we're happy to be there again. For those of you who are not familiar with the details, these are appointment only that can be found on our website. I'm proud we've been there. This is our third week. I'm happy to say that yesterday we vaccinated 1,080 people between about 9:30 and 3:30 yesterday. One of my messages to the Roseville community is, I know it's hard to get an appointment. Keep trying. We only open up appointments for clinics that we know we have vaccine. And if you have an appointment, please don't get there early. On time is sufficient. Getting there early creates lines that are unnecessary. If you've been to the clinic already, I'm sure you'll say that it's being run very professionally, very calm, and it's being very successful. Next slide. So there's a lot of question about all the doses we've received. Have we utilized every dose? So folks need to remember that we get allocated once a week. We never know what we're going to receive. The amounts are variable. And when they distribute to us, we get first doses and then we get second doses. So we have to sit on the second doses so that, 28 days later, if you have Moderna, or 21 days later, if you have a Pfizer, that you'll get your booster dose. So as you see numbers on television, for the most part, they're looking at the total amount of vaccine that have gone to either the state or the counties. They typically don't look at first doses. So we're doing very well at utilizing most of our first doses. Like I said, we don't schedule clinics at the grounds unless we know we have vaccine, and we're doing quite well. I wish, frankly, we have far more capacity than we have vaccine right now. I'm afraid that's going to be the story for a little while until we get more, until more is available. And with that, I think that's the end of my presentation.
Yeah, thanks, Mike. I'll just say again, we appreciate the opportunity to speak with you. Would love to come back. So happy to come back anytime, and happy to answer any questions you'll have. Thank you.
Thank you very much, Dr. Oldham. Does the council have any questions of either Dr. Oldham or Mr. Romero?
Mayor Rusconi, I just had one, Pauline Rakucci. If you get a first dose at the grounds, do you get your second dose there also? Do you make an appointment and get one?
Yes, and I know that's because some places are scheduling the second dose at the time of the appointment. We're and Mike can speak more to this, using kind of a text and email alerts for those second doses at the ground. So a little bit depends on where you get your where you get vaccinated. But right now at the grounds, we're doing that with our with email or text reminder. Is there anything else you'd like to say about that, Mike?
Yeah. So anyone, you should feel rest assured that we're reserving our second doses. There's been a lot of thought about should we dive into the second doses, utilize them as first doses. We're tempted to do so, but it's like borrowing money from yourself. It's kind of a challenge. So we will preserve the second doses. We will communicate those who got vaccinated to schedule their next appointment or their next appointment. And just I mentioned the days after. So if you get Moderna vaccine, you get your second dose anytime after the 28th day. If it's Pfizer, it's anytime after the 21st day. So a lot of folks are hung up on the precision of 21 and 28. It's just not true. So anytime after those dates is when the booster will have the intended impact.
Thank you, because I had people ask me. Thank you very much.
Does the council have any other questions?
Scott has a question. He has his hand up.
Councilmember Albert?
Thank you. I'm just curious at what the county is planning to do. Right now we have a challenge with people not wanting to wear masks. A lot of the community is cooperating, but there's some that just refuse and they're being difficult. And now I'm just imagining I've been vaccinated, therefore I don't have to wear a mask excuse. How are we going to message that out? And I just worry about gatherings and that being the reason for people getting together. And Just wonder if you guys could address that, because that makes me a little nervous.
Yeah, thank you. It's an important thing that we're going to have to message, and that's the fear. Is as Mike said, this is really exciting for public health to have a vaccine, but the fear is that that we start to let down our guard because as people get vaccinated, they think that they don't need to wear a mask, or they can ease off the distancing, and it's really not the case. So one is there's really no way to know who's been vaccinated and who's not, but also the science really isn't there to say that's going to significantly decrease the risk of transmission. We know that it will decrease the risk of people getting sick, but it's still to be seen what impact. We think it'll have some impact on transmission, but for sure, what we're planning is kind of a campaign, taking some of the Mask Up campaign that we've had in partnership with a Placer Community Foundation and other organizations, and kind of tailoring that now for you've been vaccinated, and kind of re-upping that messaging around populations who have been getting out the message, because one of the things we haven't talked about is some vaccine hesitancy, and so we still have large numbers of people who aren't sure. They're not declining the vaccine, but they're just not sure if they want it or not, and so we're going to address that, especially to make sure that in certain populations that we make sure that are prone to having negative consequences from COVID, that we deliver those messages into those communities, but also as they get the vaccine, to make sure they understand kind of the implications of that. So we have materials when people get vaccinated about that. CDC has put out some good information around that, but I think we're going to have a lot of work to do in coming months. Mike, anything else you'd like to say on that?
Just to reiterate that, when you get vaccinated, you should feel good that your risk of mortality is significantly lowered. You should feel good that your risk of morbidity, of getting sick or getting very sick, is significantly reduced. There's never a zero risk. But the question is, and we need time for science to figure out, I've been vaccinated, can I still get infected, and therefore can I still be infectious? And in January, we don't know the answer to that question. The scientific community needs time to figure that out, and I think ultimately that will impact the CDC's recommendations about mask wearing. So I think it's really one of those, the jury's still out, and so my request to residents would be patient. Look for really the leadership from the CDC recommending when it's time to put the masks away.
Mayor, I may have some questions after the public has an opportunity to ask questions.
I think right now we're doing council comments. So now would be a great time if you are comfortable asking your questions, Councilmember Haldeshout or Vice Mayor Haldeshout.
Yeah, I have 3 questions. And a question you often get, Dr. Oldham, is, can you explain ICU capacity?
Yeah, well, I think the short answer is no.
Okay.
It's really complicated. I can try, but the capacity. Basically, we have a variable number of ICU beds in Placer County at any one time, and at least what the metric is based off of staffed ICU beds, and so that's the big the big challenge is with staffing, and so we obviously have variability in the demand for ICU care, but we also have kind of the supply, the number of staffed beds changing from day to day. So that in itself is complicated, and but then, as I mentioned, figuring out what does it mean relative to it's just not something ICU bed capacity. I know that was a trigger for the regional stay-at-home order, and it's a perfectly good trigger, right? I mean, it's an important thing, and when we look at other places like in LA and the Central Valley that had very limited, zero ICU bed capacity, it's scary, and that's we know that it can affect the standard of care even that can be delivered when we don't have enough ICU beds. So I think it's important to look at it, but the reason, it's not a very standardized metric in tracking what the capacity is over time. It's not something that we've, like some of the other metrics we've been tracking for a long period of time. We can tell you, this is what it was in June, and this is what it is today, and so therefore we can make some valid comparisons. It's just really tough to do with the ICU bed capacity.
Well, let's see if I got, I'm a good student here. Somebody once explained to me that once you get to 30% of your ICU beds with COVID positive cases, then for every percent you go up, you lower that availability by 0.5% because there are other needs for those ICU beds beyond COVID. Is that a fair characterization? You know, we
Yes,
still have stroke in
right.
the community, car accidents, heart attacks. Okay.
Absolutely, yeah. And again, that they, even prior to COVID, we had huge variability in this. The number of people who are in the ICU over time. There are certain seasons, like January is just normally a season of the year where you see more ICU hospitalizations. So we have some look at ICU hospitalizations, but this capacity, looking at the percentage of the beds that are open, is not something that the hospitals are used to reporting to. So we can't go back and kind of look at those over time.
So last Friday, I got my first dose of Moderna. And then I noticed this week, and I want to make sure I understand this correctly, because of 10 cases in San Diego, you, out of a super abundance of caution, the whole state, I think, not just you,
right,
shifted to Pfizer. Do you?
No, look.
Yeah. Go ahead.
Yeah, so it was just one particular lot of the Moderna that was suspended. Okay. So the state, actually the CDC in the state said, let's pause to investigate what happened. There were a handful of people, I think it was at a very large mass vaccination clinic in San Diego. And so that investigation, I think, is still underway. I'm hearing that likely that'll be, that investigation will be done very soon. Okay. And so that's just one of the lots of Moderna. We continue to use other Moderna lots, such as one particular lot of Moderna. We just happen in Placer County to have 2,900 of doses from that lot. So a big chunk. And what Mike didn't say, he was saying, oh yeah, we're not, because we did look at using second doses as first doses. That was what the state had recommended to us to consider, given the vaccine limitations. And so we were actually looking at doing that, and that was the lot we were planning on utilizing for our clinic on Tuesday. So we were able to really scramble, and thanks to our hospital partners, as Mike says, you don't do anything in COVID alone, and so working with our hospital partners are able to fill that clinic. Otherwise, we were completely out of vaccine. So that's how close it was, and that's the reason why we at the last minute said, well, because we'd already told those people who were coming on Tuesday to the grounds that they would be getting Moderna, and so that's the reason we sent out the release saying, actually, you're going to be getting Pfizer, because that's all we could borrow from our hospitals.
Well, I got to compliment you on your resiliency, your stamina, first of all, right? Because, it was last Wednesday when the governor announced, but 65 and above, right? I called my I happened to be talking to my neighbor earlier in the day, and this is my question. He was having a hard time connecting with the physician group to know when he was in the queue. I think you've gotten that. Could you talk about that? Has that become a little more seamless? He happened to be with an independent physicians group. Is that more notification going out to folks like that so they know, so their doctors know?
Yeah, and it's I don't know if that goes as far as seamless. There's still a lot of seams in this system, and so we are trying to fill in, because we have in the 65 and up category in Placer County, we estimate about 80,000 people. So all of a sudden we had, and actually large numbers. There's vaccine hesitancy among other populations, but anecdotally, not so much vaccine hesitancy among seniors, and so they're ready to get their vaccine, and everyone all together, calling. Unfortunately, the scheduling, and so we haven't talked much about the online scheduling, but that's been something that we really warned the state about. This is the state's system for scheduling really is not great for going in and for the general public. We were using it primarily for the 1A, the employment-based scheduling, and it was clunky, but it was working fine. But with this mass number of thousands of people trying to schedule all at once, it's really been challenging. And we're also anecdotally, not anecdotally, we're getting lots of complaints about that clunkiness, particularly among older adults and people who don't even have access to computer, internet connections in order to go in and schedule. So we're working with 211 to try to come up with kind of additional supports to make sure so that the online scheduling isn't a barrier, isn't further exacerbating health disparities that we already see as far as who's getting the vaccine. We want to make sure that it's available to all of our residents.
And Rob, so that system that Rob describes as clunky, we know that the state is going to change that system. We don't have a timeline, but expect that to change. So you might be scheduling your second dose. It might be a different system. For residents who are struggling, whether it's using their computer or making an appointment, I recommend that, find a loved one, a friend who's very computer comfortable and ask for their help. As I mentioned earlier, we don't open up appointments until we have vaccine for clinics. Unfortunately, that creates this, unintended rush of scheduling. So if you're having trouble, find someone to help you out. I wish that there was an easy way to schedule everyone in a fair and equitable way. Right now, it's who can schedule first and the fastest. So one of the things you won't see from us, we hope, is long lines of cars interrupting city streets in Roseville. That's the value of the appointment-only model. Without that, we'd have countless individuals and cars, and that's not good for traffic. It's not good for public safety. You see that in other communities. You've seen that on the news, the long lines. We don't intend to do that. That's why we're committed to the schedule. It really is the best thing to do. It also guarantees you you're going to have vaccine when you show up. So we've gotten a lot of questions and criticism. Why aren't you doing it this way? Why aren't you doing this that way? We have a lot of experience running vaccine clinics, and so we know the best ways to have an appointment, get there on time, being confident that you're going to get what you expect to get there, and then and hopefully have a positive experience as a good example of government and private entities working and public entities working well together.
So if someone is not ambulatory, right, because that line is long, is there a way for them at the grounds to then be able to get by the exit or something like that? I mean, or do they just have to go to their healthcare provider?
Yeah, so if someone has an appointment and if they're not ambulatory, we have staff looking out for them, and we'll help them to make sure their experience is as quick as possible. You mentioned the healthcare provider, so I know it's a common answer from us to say call your healthcare provider. Right. There will be a time for that. The time's not today, right? If you call your healthcare provider, they're going to say, I don't have a vaccine yet, because they don't. There's not enough vaccine to get to the primary care providers who are interested and available, right? I do believe that Kaiser and Sutter are ramping up their plans. They might have something that looks more like centralized vaccination clinics like ours at the grounds. I don't have a date. I don't have a location. But for Sutter and Kaiser, it behooves them to centralize such things, right? So expect to see that, and expect to see some announcements relatively soon. I think it's too early to call your primary care provider. They're getting as many phone calls as we are, but they simply don't have the vaccine. Hopefully, within a relatively short amount of time, enough vaccine will come to our community where we can allocate to every provider who's interested in providing vaccine to their patients.
So one more question and then a comment. So I was glad to see the charts you showed earlier about hospitalization and ICU capacity seeming to be trending in a well, let me just say that over the weekend, the Institute of Health Metrics, the Bill Gates University of Washington came out and said that we've seen the peak, we've crested with the winter surge, and so I know Los Angeles has probably a unique set of problems down there. But when are we going to be able to gather with our masks on, with our friends, much like the inauguration today, which was physically distanced? But when are we going to be able to do that again, I guess? And my comment is, I'm over 65, so Deep Purple was one of my favorite groups, but not one of my favorite colors. Okay, let's just say that. But it seems like there's some consensus building around the fact that we've got to the crest. I guess it's how long the plateau is, but when do you think we'll be out gathering with our masks on?
A great question, and obviously the answer is we don't know. We're always hesitant to predict the future because so much about this pandemic has been unpredictable. But I do think it's encouraging. We're now coming up on 3 weeks out from New Year's, and so that was really what we were worried about, right? Was the Christmas holiday and New Year's, and the gatherings that we saw around Thanksgiving seemed to be driving a lot of transmission, and so far haven't seen that spike in cases and test positivity. Like I showed, it's still high, but it's not shooting up. So I think all we can say is that's encouraging. But as far as reading that into the future, given how again with the vaccine distribution, how that changes people's behavior, what we have seen is how quickly we were just back in October. We were talking about a yellow tier, right? And so how quickly things can change with this virus, and particularly, now you're hearing about different variants that maybe can spread even more quickly. And so I would love to be able to prognosticate and say, I'm glad you're saying when are we going to get together with our masks on, because I do think for probably most of this year gatherings will entail some distancing and masks. But it's really tough to say. I'd say we're looking at this summer. I think that there'll be vaccine available to everybody by this summer sometime, including that's one of the questions around school age children. It's not, the vaccines really aren't approved, FDA approved for children yet, but expect that research to move forward. So hopefully we'll have other groups who have access to vaccine by the summer. And I do think that the science will come out and show that the vaccine hopefully has some impact on transmission. So I think it's by the end of this year, I would really hope that we'll be getting together and gathering again. Something that comes up is like conferences, professional organizations, and I say don't plan the conference for this spring, right? Fall makes a lot more sense. So I don't know. Mike is a better prognosticator. He has this magic 8-ball there. So what say you, Mike?
I think that it's going to really depend, obviously, on the vaccine rollout, but also the percentage of the population that accepts it. 50% is not enough. We get somewhere around 70%. So imagine 7 out of 10 people at a party who've been vaccinated. Even if there's virus out there, the spread, we're going to see the cases go down considerably. So as we get more vaccine, there will still be spread, but the cases are going to be fewer, and we'll be able to see that data, and then we'll start to know that the vaccine. People talk a lot about herd immunity. I don't usually like to talk too much about it. It's complicated, but just this notion of if most people in a room are vaccinated, then the spread will be less, the cases will be less. We'll see hospitalizations drop. We'll certainly see deaths drop, and then we'll know we're in the right direction. And I think then the CDC and then the state will start looking and go, okay, we're going in the right direction. Then I think they'll start having those conversations about, can gatherings increase? How long do we keep the masks on? I think we have a tremendous amount of data, right? And a pretty decent system of a timely surveillance. And so I think we'll start to know when it feels like, I think we're doing better. So I think we'll see it coming, which is unusual in an event like this. So I'm hopeful, but the timing of it, I think about the school year. Will the school year start normal? that's sort of my goal is if school can start normal, then I think we're on the right path. I won't predict that now. That's my hope, though. I hope that kids start school and we're not worrying about the distance between desks, for example.
Well, thank you both, and I can personally attest your staff was amazing on Friday. Very, very cordial, patient, even though the computer inside the building was a little, glitzy, but no, thank them all, right?
We will. You mentioned the resilience. That's really our staff has been amazing. I mean, I just came back from Sutter, but people like Mike have been at this working 7 days a week with no vacation, no days off for a long time. And so it's remarkable how resilient our staff have been, our partners. I mentioned the healthcare workers and really, everyone. So it's been a team effort for sure.
Does the council have any more questions before we move on to public comment? And hoping that you two can stick around just in case there are calls that come in, which I'm sure they have. So if there are not any more questions of Dr. Oldham or Mr. Romero, I'll open it up to public comment. And the call-in number is 916-774-5353. You can also submit public comment to publiccomment@roseville.ca.us. I understand there are a few maybe calls and emails. We'll go ahead and take the calls first. Is that correct?
Yes, calls first.
Hi, you can go ahead.
Thank you. Good evening, council members, Mayor Bernasconi, and thank you, Dr. Oldham, and I'm forgetting the name of your staff member, who gave wonderful presentations. My name is Kathleen Crawford. I live in Sun City, Roseville, and I want to tell you that the feedback from local Sun City residents who are going to the grounds has been excellent. People have been very satisfied, both with the way they were able to sign up and the treatment and the lines and the way things moved through Jones Hall at the grounds. So, you really did get a well-organized, and people are very grateful. I have a comment in that neither Kaiser nor Sutter are accepting anyone under the age of 75 at the current time. The grounds is the only one that is taking people 65 and up. I'm a Kaiser member, and I've seen emails from both Kaiser and Sutter that indicate that they're sticking with the 75-year-old level currently, mostly because of lack of vaccine. And I think that is obviously a public issue that certainly the county is going to be wanting to make sure the state, who is clearly, obviously, equally aware that we have to get much more vaccine into the state in order to vaccinate people. I think there needs to be special attention paid to making sure that the communications that come out from the county encourage vaccinations. I agree that the over 65 age group is not vaccine hesitant in any way. We saw polio. We've seen lots of things in our lifetime that tell us that vaccines are very safe and very good public health measures. But that age group between 25 and 50 has a great number of anti-vaxxer people who are very suspicious and not inclined to get a vaccine. And I think that public health messaging needs to be targeted to those groups, because they will be our difficult group to convince to get in for their vaccine. And you have time to message them, and you have time to develop some trust with them. And I think that that's very important. If we are going to get up to 70 or 80% herd safety, we need that group to be part of it, because children are unlikely to be vaccinated before the summer or shortly before school starts again in the fall. So I'm very pleased with what's going on. The one other thing that I would hope that the county could start to do a better job of is enforcement, either through the health guidelines with restaurants and other people who are clearly defying the no indoor seating and other issues. That would be a big help. We've not disconcerting for those of us who are really trying to help bend this curve downward to both protect public health and protect the safety of the people who are most vulnerable. Again, thank you very much for this report. I certainly hope that you'll be coming back soon with more indications of the increasing supply of vaccines. And I really appreciate all that the county and the city is doing. It's a huge task in front of all of us. Thank you.
Thank you. Okay, we have one more call. Hi, you can go ahead and state your name, and you're on.
Thank you. Lisa Larkin, Roseville, California. Sorry I missed you all last week with the change in date. I had another conflict. I did want to make some comments. Recently also attended the Board of Supervisors meeting once again, where they are also not demonstrating or leading by example with wearing masks. And when you put a post on your wall that says, wear masks, and then you don't do it, and you disregard the health of your other colleagues and the people in the room, I think that's the first place that needs to be addressed. Now, obviously, that's not Roseville City Council members that are doing that. However, a newly elected council member, Mr. Mendoza, in December made a post on his wall when restaurants weren't supposed to be open, basically saying, looking to have dinner indoors. Who knows of any open restaurants, and I don't want to get any of them in trouble, so private message me. That's the wrong example, and I was shocked to see that by a newly elected council member, and you can't expect the public to join forces to put a stop to this this virus that's making the rounds. We all want to see businesses open, but if we can't all get together and work through this, and like the last caller talked about vaccinations and anti-vaxxers and conspiracy theories and whatever it is, we're never going to get past that. The seroprevalence study they did said that only 2.4% of the people actually, are coming up positive, right? And a lot of them, they said, were surprised that they were infected, which makes even more reason for wearing those masks, because people are carrying the virus and spreading it, and they don't know that they even have it. So the asymptomatic people. I do want to thank the fairgrounds. I have heard from my own mother, who's nearly 80, who had a good experience at the fairgrounds. She was supposed to get the Moderna. It was cold because she has allergies. She did go ahead and get the Pfizer and had a great experience, was in and out. She waited in the parking lot, make sure she didn't have any, problems. So I wanted to thank whoever's organizing that. It's being done really well. But I do want to comment that I would like to see cancer patients and their caregivers moved up on this list. There are so many of them that are going through therapy, and I don't know if it's because they don't know with the study if it's safe to give them those treatments, but nonetheless, maybe not the cancer patients, but maybe their at-home caregivers and family members who are around them because their immune is being knocked down from chemotherapy and what have you. So my question would be, is that being considered? And if not, can it be brought up to see if it can be considered? Thank you.
Thank you. Okay, did we want to respond to any of that before moving on to email?
I'm fine moving on with email.
Okay. So we had one email from someone who wishes to remain anonymous, we may have another call coming in, but someone who wishes to remain anonymous talking about a church that was violating health guidelines. So we have alerted our folks at the city who follow up on their education process with that. There's a question from Debbie Ferguson, who's asking, will second doses be prioritized, and can there be a separate sign-up method for second doses? She's concerned about the effectiveness if she doesn't get her second dose of Moderna 20 days after the first.
Yeah, I think Mike spoke to that a little bit. The timing of the second dose. It's just as effective if you get it later. There's a lot of discussion we talked about the second doses and how we're going to schedule those. So I don't know, Mike, if there's anything else you'd like to say about that. I know you kind of already addressed.
Yeah, just that, for those of you who got vaccinated at the grounds, you'll be getting, we have your email, right, because you signed up. We'll be reaching out to you to schedule your second dose. You should feel confident that it will be there. And it just has to be, if you got Pfizer, it's after the 21st day. If it's Moderna, after the 28th. There's lots of room there. We just don't want to get you beforehand. It won't be as effective as a booster.
Okay. Great. And then there was one more question from Bruce Holder, who's asking, what day of the week do new shipments of vaccine get distributed?
It's a great question. So from week to week, we don't know when the state's going to let us know what our allocation is. It could be a Monday, it could be a Tuesday. There's no way to know. We don't know how much it's going to be. But typically, it's usually by Thursday, let's say. And typically the vaccine arrives on Monday. Not this week, which was a surprise the holiday, of course, but we expected it yesterday and it didn't arrive yesterday. We are able to track it like you track any other package. So the reason I bring that up is we're at the will of the manufacturers, of the distributors, the state of what they allocate, and just the logistics of shipping. So we never know, and that's why we don't schedule clinics until we know that we have vaccine. I know it's frustrating for residents who just want to get that appointment, know that they're going to be okay. We're going to do our best not to schedule and cancel things where possible. So yes, weekly we learn, weekly we receive, but never on the same day.
Great. Mayor Bernasconi, that concludes public comments for this item.
Thank you so much. And to Dr. Oldham and Mr. Romero, thank you so much for your comments. I know my colleagues on the council appreciate it. The residents of Roseville appreciate it. And I'm sure it's informative to the staff as well. So thank you so much for all that you are doing and for your time this evening. We appreciate it.
Thanks so much for the opportunity. Have a good night.
Thank you both.
Thank you.
Okay, and I will close public comment. Are there any other comments from the council? This is an information item. We will not be taking any action on it.
Not for me.
Okay, thank you. We will move on to public comment. And this is the time for anyone to call on any items that are not on the agenda. The number to call in is 916-774-5353. You may also send in your public comment via email to publiccomment@roseville.ca.us. We will take phone calls first. Megan, are there any calls this evening?
Yes, Mayor Bernasconi, we have a couple of calls, and I'll put the first one through right now.
Thank you.
Okay, you can go ahead.
Okay, my name's Brooke James, and this is my first time calling into a council meeting, so I'll try to keep this brief, and thank you for taking my call. I was calling because I've been spending a lot of time studying homelessness, and I'm a very disappointed and concerned Roseville resident and taxpayer. And I've done a lot of research on homelessness and solutions that work for homelessness. And I wanted to just make a suggestion to our council, that there's such a growing awareness and controversy around homelessness in Roseville, to read the book Answers Behind the Red Door, called Battling Homelessness by Michelle Steele, if you truly want to help homelessness. It's very eye-opening. And my comments about the permanent supportive housing that's secretly being dropped into single-family zoning of Roseville neighborhoods that are actually unsupervised. We've done a lot of research with numerous citizens in Roseville, and we're very concerned because we pay so much money for taxes, and we moved to Roseville to live in nice neighborhoods so that our kids can be safe when they go to school. dropped in very expensive neighborhoods and looking into backyards and across from schools. And I was shocked to find out that they have in-ground pools, and I was worried about the liability of Roseville because the people that are is temporarily mental ill and addicts. And I just see here now schools not gated, and I feel like it's a huge waste of money to addicts. It should be that encourages rehabilitation and then the quiet curfews, and they should not be allowed to have guests over, and to have consideration to the taxpayers that live here and are voting our council in. So what I'm asking is pleading with Roseville to please, please, please have the Rose residents' heart at hand and send a letter to the Board of Supervisors consulting this activity in dollars will only help a handful of us that actually have checks. And this money should have went to landlord pools or mental health, just did. It's shocking behavior, and I really feel that you guys should put something out in the press that you condone this activity and that you see safety as a priority. And these service providers, just for the public listening in, and housing and the gathering in. And the gathering in doesn't even post its current public taxes. And people are trying to get receipts and they can't get a copy of it. And also has a tax lien. It's shocking that he's getting money from Roseville and the county. And we're really asking for some research to be put on this, that millions of dollars are being spent in the best way, and to actually maybe create housing for these people. And these houses should be sold. So please with Placer County to sell these homes immediately while the market is high.
Hi, Brooke, you're going to have to wrap it up. There's 3 minutes for general public comment.
Once they don't put the Main Street permanent sort of housing you're building at the apartment, or temporarily put them at the COVID Hampton Inn that's being funded millions of dollars by Placer County, but get these out of neighborhoods and make our neighborhoods safe again, and send a message to Placer County Board Supervisors for us. We would greatly appreciate it. Thank you so much.
Okay. All right. We have another. That one to come through.
Are there more calls, Megan?
Yeah, we are. We have 2 more calls. So hold on just a second. Hi, you can go ahead, state your name, and you have 3 minutes for comment.
Hello, my name is Lamille Garrett, Council. First off, I want to thank City Manager, Stacey, and staff for the work that they've been doing and the process they've gone about for taking public input on the House. I also, I submitted written statements, and some of them I also want to make sure that I reiterate here for the Council publicly via voice regarding the importance of making sure that we're actually using the tool called home equity. That hopefully I think everyone understands that home equity isn't something that anyone does anything to earn or get. You hope it goes up. And thankfully we live in a city where we typically benefit of that for those of us who are homeowners, and it does go up. However, within many tools that are available to our citizens under the housing element, especially for affordable housing, there seems to be a very strong bias towards only making rental options available for those of low income, which in my point of view is extremely biased. That cuts people out of the opportunity to move from one income level to the next. And I would probably say most people that I know and am familiar with have neighborhood or to home value or to leverage in hopes of buying or leveraging for items to be purchased to build personal wealth. When we create that only give home equity to those of a certain income level, we're only assuring that those people will get the benefit of the good that comes out of our city. However, when we're looking at the lower income and low income or very low income, and we exclude them from tools of equity within home ownership, whether that be condominiums or otherwise, we're now excluding them from the benefit of moving up the financial level. So whether that's waiter and waitresses or dealers or someone who works at one of the many restaurants that we have or work in our hotel environment, we want them to be able to continuously grow their personal wealth, be able to move into different income levels, and to be able to mature in that way. And so my ask to you is, as you begin to get aware of and hear recommendations from the city regarding the housing element, is to make sure that you are actually putting the push for affordable housing for the lower income and very low income that actually includes options for equity. Thank you very much for listening. And again, thanks to the staff that's been working on this. That's it. Goodbye.
Thank you very much. Okay, Mayor Bernasconi, we have 2 more callers, so I'll wait for the next one to come through. Hi, you've reached Roseville Public Comment. Please state your name and you have 3 minutes to make your comments.
Hi, my name is Brian. There's things I like to address. So we're having an issue on Auburn and White Avenue. There is a big, huge pothole. It needs to be fixed, and we need to have crews over there quickly and fix it up, patch it up or something. At least repave the whole road. There's like a cone right there, which we do need to notify the public works workers to go out there, street maintenance to fix it. It's enough to damage a vehicle. One of the bus drivers told me they almost damaged their vehicle going over it, and that's the problem over there. So it needs to be fixed. Thank you.
Thank you. One more caller at this point. Hi, you've reached Roseville Public Comment, and you have 3 minutes to make your comments. Go ahead.
Thank you. Lisa, Roseville, California. I just want to follow up. I know the Board of Supervisors meeting had a presentation on body armor for officers, and it seems that everybody is on board with that, and I believe that this is something that should happen, and I was just wondering if there is a chance at one of the next future Roseville City Council meetings that we can have an update on how that is progressing and getting our Roseville City police officers, not body armor, but body cameras. And also, with the light of what has been going on with the various groups online, the attack on the Capitol, I'd like to know if there's anything being done with our police force, whether we're only going to address Roseville City police officers right now, to vet those officers to see if any of them are a part of those groups. Those are my comments. Thank you.
Thank you. And that is all that we have on the telephone public comments. We did get one email general public comment from Nicole Zoza asking if we were, this is the city's planning to sell houses owned by TGI Housing. And she's not happy that she lives close to one of the homes in Fittiment Farm. And that concludes public comments, Mayor Bernasconi.
Thank you so much, Megan. I will close public comment and we'll ask the clerk, I'll ask the clerk to please announce the meeting procedures for the consent calendar.
All matters on the consent calendar are considered to be routine in nature and will be passed by one motion. There will be no discussion of these items unless a member of the City Council, staff, or the public requests an item be removed. This evening, we do have an item removed, 7.21, appointment to auxiliary boards and commissions. Mayor Bernasconi, if you'd inquire if there are any calls or emails requesting an item be removed.
Are there any other calls for any items to be removed? Okay, seeing none, we'll have a motion for the consent calendar?
Correct.
No, there aren't, Mayor Bernasconi.
Thank you.
So moved.
Second.
Vice Mayor Haddishelt.
Yes.
Vice Mayor Haddishelt.
Yes.
Councilmember Albert.
Yes.
Councilmember Rakucci.
Yes.
Councilmember Mendoza.
Yes.
And Mayor Bernasconi.
Yes.
So Mayor, would you like to speak to item 7.21?
Yes, thank you. Item 7.21 this evening is our assignments, the council's assignments for our boards and commissions that we serve on as council members. And it came to my attention that the appointment for SACOG had both myself as the main representative and Vice Mayor Haddishelt as on the transportation subcommittee. And after speaking with staff at SACOG, I'd like to request that I serve in both capacities as a subcommittee member as well as the primary representative to SACOG.
Let's do it.
Yes. Agreed.
We need to open the item for public comment.
I'd like to open the item now for public comment. And I know we are on a delay, so I want to give an opportunity for anybody to call in.
We don't have any calls at this point, and we haven't received any emails either.
Okay.
Mayor Bernasconi, I'll move the change on the auxiliary boards and commissions, having you serve on the SACOG Transportation, Innovation and Transportation. I don't have the exact name in front of me, but having you slide into that place, and I guess I'd be the alternate. I don't know. But
yes, thank you.
So the motion is to modify the list, moving Krista to the SACOG Transportation, and to approve the remaining list of appointments as presented. So Bruce, you have the motion. Who has second?
Second for Pauline.
Hey, Vice Mayor Haddishelt.
yes.
Councilmember Albert.
Yes.
Councilmember Rakucci.
Yes.
Councilmember Mendoza.
Yes.
And Mayor Bernasconi.
Yes, thank you so much. That is the end of our consent calendar. We'll move into item 8.1, fiscal year 2019-20 year-end report and budget adjustment.
Good evening, Mayor Bernasconi and council members. My name is Dennis Kaufman, and I'm the Assistant City Manager and Chief Financial Officer. And this agenda item includes the year-end budget report, a brief budget update, and a recommended budget adjustment. My presentation is organized by the city's various funds. Then I'll provide a brief budget update, and I'll wrap up with the recommended budget adjustment. This year-end report is for the past fiscal year, which ended on June 30th of 2020. Another agenda item approved on consent tonight was a set of financial audit reports, including the city's comprehensive annual financial report, or the CAFR. The CAFR is the annual independent audit required by the city charter that encompasses all of the city's 200 plus funds. I want to take a quick minute to recognize the city's accounting team for their efforts in closing the books on last fiscal year, producing the city's CAFR, and earning a clean audit opinion on the city's financial statements. The focus of this presentation tonight is on the budgetary results of the general fund, enterprise funds, and a few other notable funds. I'll start with the general fund. The final general fund budgetary results for last fiscal year generated $7.7 million of a one-time increase in fund balance from $3.2 million of revenue received in excess of budget, expenditures which were less than budget by $4.9 million, and non-operating activity that fell short of estimates by about $400,000. I have more detail on the following slides. I have two tables for the general fund operating revenue results. This table provides a list of the primary revenue sources making up that $3.2 million of positive results. The Bradley Burns sales tax, which is the largest general fund revenue, ended the year $2.4 million below the budget estimate due to the COVID-19 pandemic. Measure B sales tax revenue, also affected by the pandemic, ended the year approximately $3.7 million above budget because the city conservatively budgeted the revenue in its first full fiscal year. Property tax revenue exceeded budget estimates by about $2.7 million due to rising property values, combined with the level of property sales activity and new development. The pandemic significantly impacted Parks, Recreation, and Libraries program revenues. Fortunately, in the general fund, the department had offsetting expenditure savings. And then other notable revenue results included the Transit Occupancy Tax, or the TOT, which ended below budget due to the pandemic, and building permit and engineering inspection fees that exceeded budget estimates last year. The next table shows the same revenue variances with their respective percentages. Compared to budget, Bradley Burns sales tax was 4% below the budget target, while property tax revenue was 5% above estimates, and overall, general fund operating revenues finished last year 2% above budget. On the expenditure side, general fund expenditures ended the year $4.9 million below budget. The primary contributing factors were savings from vacant positions, which in some cases were not filled, to generate savings to help the city address the uncertainty of the economic downturn. And some departments also experienced savings due to programs or activities that were paused or canceled due to the pandemic. Overall, general fund operating expenditures finished the year 3% below budget. With the $7.7 million in general fund budgetary results, staff recommend council approve a budget adjustment to appropriate $400,000 to fund a contract obligation to relocate overhead electric lines on a parcel of land exchanged by the city, and to transfer approximately $70,000 to the Youth Development Fund to provide a subsidy down payment to address the year-end deficit created by the pandemic's impacts on the city's Adventure Club operations. And I'll present more information about the Youth Development Fund later in my presentation. Finally, staff recommends transferring the remaining $7.3 million to the General Fund Stabilization Reserve. This transfer, if approved, will bring the reserve balance up to 14.6% of general fund expenditures, just shy of the council's 15% goal. And I'll return to this slide at the end of my presentation. Next, I'll provide some year-end results information for the city's enterprise funds. This table presents the revenue results for the city's enterprise funds. The results varied widely by fund, so I'll review a few highlights on the next couple slides. The electric fund ended last year below budget estimates by $2.1 million, which is a variance of less than 1%. The primary factor was a decline in retail electricity sales. Revenue was down $2.7 million due to the pandemic, and by $1.8 million due to reduced usage by some of the larger commercial customers. Wholesale electricity sales revenue partially offset the shortfall in the retail sales. The Environmental Utilities Department enterprise funds exceeded their revenue budget estimates by between 4 and 11%, due primarily to continued growth in the city exceeding budget projections. And the city's transit enterprise ended the year below its revenue budget by $1.3 million, due primarily to reduced demand for services caused by the pandemic. As staff have presented previously, federal stimulus funding was approved to help transit agencies mitigate this lost revenue. The Transportation Fund ended the year above revenue estimates due to local transportation funding received for some of the city's projects. And finally, the Youth Development Fund ended the year below budget estimates by $1.4 million due to program closures due to the pandemic. The Parks, Recreation, and Libraries Department reduced expenditures, including temporary part-time staffing, to partially offset the lost revenue. The city's enterprise funds all ended last year under budget on expenditures, and I'll review the primary factors for each of the funds on the next two slides. The electric fund ended last year under budget by $9.2 million, or 7% of its budget. Lower purchase power and fuel costs, along with labor and travel and training savings associated with the pandemic, were the primary factors. The environmental utilities funds ended the year between 12 and 18% under budget on expenses. Water, wastewater, and waste services had salary savings from vacant positions and lower than expected materials, services, and supply costs. The transit enterprise closed last year 2% under budget on expenses. Despite higher costs for enhanced bus and shelter cleaning and disinfection, transit reduced operating costs by adjusting bus routes. The transportation fund ended the fiscal year under budget by about $451,000 due to salary savings from vacant positions and lower than projected materials, services, and supply costs. The Youth Development Fund achieved $400,000 of expenditure savings to partially offset the pandemic revenue losses. Temporary part-time employees were laid off early in the pandemic when the program was shut down. Full-time staff have continued to serve the community, including providing support to other department programs. And although the Youth Development Fund started last fiscal year with a healthy fund balance, the COVID pandemic caused significant deficit spending that resulted in a year-end deficit fund balance of $70,000. And staff is recommending a transfer from the general fund to address this deficit as a down payment of support until the full impact of the pandemic is known. Next, I'll provide information on 3 other notable city funds. This table summarizes budget and actual results for last fiscal year and the percentage variances. I have highlights on the next slide for each of these. Revenue budgets for these development fee funds are based on an analysis of multi-year trends in single-family, multifamily, and commercial development, including prior year revenue collections. The city's fire facilities fee ended last year slightly below the prior year revenue level, but did exceed the budget estimate by 4%. Revenue in the public facilities fee and strategic improvement funds both exceeded the prior year revenue, but both fell short of the revenue budget. However, the strategic improvement fund revenue budget included $584,000 in surplus property sales revenue that wasn't realized last fiscal year. After taking that unrealized revenue into consideration, the SIF revenue would have exceeded the budget estimate by 13%. This next slide summarizes the activity and the fund balances of these 3 development fee funds for last year. The fire facilities fee ended last year just about $4 million. The public facilities fee fund ended about $6.5 million, and the SIF ended at about $9.4 million. Since our last significant budget update was back in October, staff have some updates on the current fiscal year budget, that's fiscal year 2020-2021. There continues to be significant uncertainty about the impact of the pandemic on the economy and the city's primary tax revenues. With the regional stay-at-home orders before the holidays, the state again offered businesses delayed tax filing and payment deferrals, as well as installment payment plans, which all add to the uncertainty about the collection of the city's sales tax revenues. Leading economists are estimating the recovery will take 2 or more years, based on an assumption that the rollout of vaccines will bring the pandemic to an end later this year. Although the state received allocation of this, although the city received allocation of some of the state's CARES Act money earlier this fiscal year, the recent federal stimulus bill that was passed did not include resources for state and local government general funds. Staff is continuing to review federal and state funding opportunities, including this recent stimulus package for other city programs, but for the city's general fund, future stimulus funding remains on. Staff recently reviewed the city's sales tax results for the July to September 2020 quarter with our sales tax consultant. Based on that information, our consultants have updated their forecast for Roseville and assume continued improvement in the local economy and, like I mentioned, a 2-year recovery period. Their updated forecast projects $53.6 million in Bradley Burns sales tax revenue this year compared to the current year budget of $50 million. And $19.3 million in Measure B sales tax compared to the current year budget of $18.5 million. Sales tax from internet sales is partially offsetting the reduced sales tax from traditional brick and mortar stores, as you would expect. And as you've probably heard reported at the state level, the pandemic has not affected sales tax revenue in California to the extent that was projected. But there is still significant uncertainty, so staff will remain cautiously optimistic as we begin developing next year's budget. Updated information from the county tax assessor's office and validated by the city's tax consultant shows that property tax revenues this year will likely exceed budget estimates by about $1.8 million to $2.3 million for the general fund. And for TOT, the hotel tax, the city has received about $1 million of the $2.26 million budget before the holidays. Hotel occupancy continues to trend higher than estimated, and staff believes final results for this year will probably meet or exceed our budget for TOT. Now, moving on to the enterprise funds, the electric utility budget for the current fiscal year assumes a 3% reduction in revenue of the pandemic. Residential electric use has remained strong as more people are working and schooling at home. However, small and medium commercial account customers continue to show weakness, with customers below 9% below revenue estimates. Past due bills delinquent more than 2 months now total about $1.7 million, which is 3 times normal, our levels of typical delinquencies. And staff are closely monitoring those past due utility bills and evaluating options. The environmental utilities funds are on target this year with their budgets and are also experiencing those higher than typical delinquency accounts and are monitoring those delinquencies. And for the Youth Development Fund, the adventure clubs have reopened, but with restrictions. The programming has been adjusted to meet lower staff to student ratios and to comply with sanitation protocols and PPE requirements. Enrollment is 1/3 of normal, and the fund will continue to operate as a deficit under these conditions. The childcare industry, as you've heard, is being significantly impacted by the pandemic, and Parks, Recreation, and Library staff plan to return to council in a couple months with an update on the programming and the financial status and outlook for the Youth Development Fund. With that budget update, we'll return to the staff recommendation for this item. Staff recommends council adopt an ordinance to approve the budget adjustment as I described earlier on this slide. And this concludes my presentation, and I'm available to answer any questions.
Thank you so much. Council, are there any questions of Dennis?
No.
Yeah, I had a couple of questions. Dennis, the reason why I was asking Mike Romero about his crystal ball, or Dr. Oldham about the crystal ball, is because of youth services, and I know you said we'll have a presentation. You know, it's probably around March or so that we begin to hire our lifeguards and a lot of those folks, right?
That is correct. However, the Youth Development Fund is primarily the before and after school childcare programs. The lifeguards and many of our other Parks, Rec, and Libraries programs are in the general fund.
Okay, so they weren't part of that savings that got realized when Parks, Recs, and Library got they were part of the savings that was realized as a result of last March's reduction in force?
The general fund programs were able to adjust both their revenue and their expenses. Okay. But it's those before and after school childcare program that was not able to adjust.
So you mentioned that they're at about 1/3 of normal. Is that because of folks not taking advantage of it, or the restrictions you mentioned about teacher to student, teacher to child ratio?
Yeah,
is the demand there?
It's the restrictions on the teacher to student ratio and the physical distancing that has to be maintained.
But the demand is there, and if we could solve that, it would not be 1/3 of normal. Okay. And then the last question is, with the undergrounding related to the city swap, would that be something that might be eligible? Should there be an infrastructure bill that comes through the federal government and results in money back to us, will we be able to then cover that cost?
That depends on the terms of the infrastructure bill. I can't give you a solid yes or no.
Okay. Thanks. Those are all my questions.
Any other questions from council?
I'll have comments later, but no questions.
Okay, thank you. At this time, I will open it up to public comment. The number to call in is 916-774-5353, or you may send an email to publiccomment@roseville.ca.us. Do we have any calls on this item?
No calls, Mayor Bernasconi, and we have not received any emails either.
Okay. I will close public comment and bring it back to the council to see if they have any questions, any comments before we ask our clerk to read the motion. Any other comments or questions?
I have a comment.
Okay.
I want to mention the stabilization fund reserve is a really important fund. And in this council, years ago, set that up. And the idea was to not kick the can down the road and put some money aside so when we have big events happen, we don't have to suddenly, freak out with our rates, or not just rates, but trying to figure out what to cut as we've been through before. And so I'm really excited that we actually have an opportunity to get this almost fully funded to what we've been desiring. I think this is a very responsible move by the staff and the council. And I'm just excited that we're able to get it up to almost that full 15% that we decided to set aside. That's so important financially for our community. I think that's just a very smart move, and I'm, again, excited to see it.
Are there any other comments before we have a motion on this?
Hey, Mayor, I'm just very happy to hear what our status is. It's still a lot of things that we have to deal with, but considering everything, we're going forward and we're very stable.
Agreed. Thank you.
Mayor Bernasconi, this is Tracy. Pauline kind of said the same thing, but I want to thank staff and for all the work in the presentation. And I'm extremely happy coming onto the council, being one of the newer people, just to be able to see that we're in such a good fiscal position. And I think that our residents definitely benefit from that long term. It's nice to see during this time that we're in such a good shape. So thank you.
Yes, thank you. And thank you to Dennis, and thank you to your team as well.
Thank you.
Can we have our clerk read our motion, please?
The motion is to adopt ordinance number 6319, ordinance of the Council of the City of Roseville authorizing certain amendments to the fiscal year 2021 budget, adopting the budget adjustments as presented, and declaring this ordinance to be immediately effective as an appropriation measure. May I have a motion?
So moved.
Second.
Vice Mayor Haddishelt?
Yes.
Councilmember Alvord?
Yes.
Councilmember Rakucci?
Yes.
Councilmember Mendoza?
Yes.
And Mayor Bernasconi?
Yes. Thank you, Sonia. Okay, we will move on to item 9.1, development impact fee report for the fiscal year, which ended June 30th, 2020.
All right. Thank you. So this next item, 9.1, is an annual report on the city's development impact fees that's required by state law. This reporting requirement was established by Assembly Bill 1600, which is referred to as the Mitigation Fee Act, or AB 1600, and was approved by the legislature in 1987. Development impact fees are charged by local governments in connection with approval of development projects. A nexus study is prepared that identifies the projects that are needed to be funded, the project costs, and it sets the appropriate fee or fees. And the purpose of these fees is to defray all or a portion of the cost of public facilities related to a development project. In Roseville, development impact fees are generally collected at the time a building permit is issued for the purpose of mitigating the impacts caused by new development.
Did we lose him?
Sounds like it.
Sounds like, it looks like he's frozen.
We'll pause for just a minute till we see if we can get him back online.
Got to love virtual. This never happens in person, huh?
We just gotta roll with it now.
I think he's leaving and coming back.
Okay, thank you.
Here, I could read this section here. I got, a couple.
Am I back?
He's back, yeah.
Yay.
You're off the hook, Scott.
Thank you.
Thank you. So how much of my presentation do we hear?
Not very much.
You're just starting. Start from the beginning.
Start at the beginning. Okay, we can do that. Were you joking?
No, I'm teasing you.
Okay.
You were at a slide that had 7 or 8 bullet points on it.
That's what I thought.
Slide
I had
4.
the list of fees, correct?
Right. That's it.
Okay.
That's it.
All right. So those are samples of the development impact fees that are charged by the city of Roseville to defray the cost of development. And if we go to the next slide, there we go. So this Mitigation Fee Act, or AB 1600, requires that the city, because we impose development impact fees, that we prepare an annual report that provides specific information about the fees. And those reporting requirements include a brief description of the fee, the beginning and ending balance of the account or the fund where we account for the fee, the amount of the fees collected and the interest that's earned, and an identification of each public improvement that's funded by the fee. And to comply with the reporting requirement, we also made this report available on the city's webpage. This item is really for information only. No council action is required, and I'm available to answer any questions.
Okay. Does the council have any questions of Dennis on this item?
No question.
Nope.
Dennis, you do this by each plan area, is that right?
No, this is for each separate fee. So if a specific plan area has its own separate fee, then there is a separate report for that fee. But some of our fees are citywide.
Okay, great. Thank you very much.
You're welcome.
Are there any other questions of the council before I open it up to public comment? Okay, I will open this up to public comment. If you'd like to make a comment on this, you may call into 916-774-5353 or send your email to publiccomment@roseville.ca.us.
No calls or emails on this item, Mayor Bernasconi, and I'm just double confirming that. And we do not have any calls or emails.
Thank you. I will close public comment. Does the council have any further questions for Dennis before we ask for a motion? Before our clerk reads the motion? Okay, seeing none. Sonia, would you like to read the motion?
To accept the Informational Development Impact Fee Report for fiscal year ended June 30th, 2020. May I have a motion?
So moved.
Pauline motioned, I seconded.
You got it. Vice Mayor Haddishelt.
Yes.
Councilmember Alvord.
Yes.
Councilmember Rakucci.
Yes.
Councilmember Mendoza.
Yes.
Mayor Bernasconi.
Yes. Thank you. Thank you, Dennis.
Thank you.
Okay, and we do have a public hearing this evening. Item 10.1, Sierra Vista Specific Plan Development Agreement Amendment. We have Kenny with us.
Open the public hearing, please.
Thank you very much. I'll open the public hearing. Thank you. And I think we'll actually be hearing from Mike Isom.
Good evening, Mayor. I'd like to introduce Kenny Shallow, who's going to be providing the presentation for you this evening.
Thank you.
Maybe.
Hi, good evening, Mayor Bernasconi and council members. My name is Kenny Shallow, Associate Planner, and I'm here tonight to present the second amendment of the Morier and Wealth Properties Development Agreement. And waiting for the presentation. Oh, there it is. So the Morier and Wealth Properties Development Agreement, or DA, is one of 9 DAs governing development of the Sierra Vista Specific Plan area. The original DA was entered into in 2010 by and between Morier Investments LLC, Wealth Properties Inc., and the City of Roseville. The proposed DA amendment will affect parcel JM21, which is a low-density residential parcel that's located along Fitiment Road, north of Baseline Road. The DEA amendment modifies the requirements and responsibilities for frontage improvements along Fitiment Road. These modifications include changing the phasing of the improvements from 2 to 3 phases, noting that the northern segment has already been constructed, and clarifying the timing for the middle and southern segments. So for example, construction of the middle segment will be required with development of parcel JM21, and the developer of this parcel would also be required to install a traffic signal at the intersection of Fitiment Road and Westlake Drive, which is just to the east of JM21. And if the developer has not commenced construction of the middle segments by November 2021, the DA amendment requires that the developer enter into a deferred improvement agreement no sooner than 4 years from recordation of this amendment. And it also allows the city to require development of the middle segment 5 years from recordation. These changes would provide a mechanism for the city to ensure the road improvements are built when needed. And the amendment will also revise sections of the DA relating to construction of groundwater wells and recycled water facilities. These changes were requested by environmental utility staff in order to be consistent with language that's used in other DAs in the plant area. This language states that if the city adopts a revised citywide water connection fee that covers the cost of construction of wells and recycled water facilities, the landowner would be relieved of the construction of these facilities as long as the landowner pays those applicable water connection fees. And lastly, the DEA amendment will clarify the city has the ability to monitor potable water consumption on a near real-term basis with the city's advanced metering infrastructure system, which will help with the city's review of water demands and achievement of water conservation goals. So in conclusion, staff finds that the proposed DA amendment is consistent with the objectives, policies, and standards specified in the general plan, Sierra Vista Specific Plan, and the zoning ordinance. The DA amendment is in conformance with the public health, safety, and general welfare, and it will not adversely affect the orderly development of the property or the preservation of property values. The DA amendment was heard by the Planning Commission on December 10th, 2020. No public comments were received, and the Planning Commission unanimously recommended approval of the DA amendment to City Council. So at this time, staff recommends City Council consider the 5 findings of fact as stated in the staff report and introduce for first reading an ordinance approving the second amendment of the Morier and Wealth Properties DA relative to the Sierra Vista Specific Plan. And that concludes my presentation. I'm available for any questions.
Thank you very much. Council, do you have any questions for Kenny?
Good presentation.
Okay, I will close public comment. And if there are no other questions, comments, deliberations from the council, can we ask our clerk to read the motion?
The motion is to adopt the 5 findings of fact and introduce for first reading an ordinance adopting the Second Amendment of the development agreement by and between the City of Roseville and Moyer Investments LLC, Moyer and Wealth Properties relative to the Sierra Vista specific plan, and authorizing the city manager to execute it on behalf of the City of Roseville. I have a motion.
Mayor Bernasconi, if I may chime in, unless I missed it, I think we didn't open up for public comment.
That's right.
Right.
And I'd also like to mention this is actually item 10.2, so we'll need to circle back to 10.1 after this one.
Oh, I believe this is 10.1.
It is 10.1.
Yeah, I think they have the same title.
Okay,
so
I probably have an older agenda then. Okay.
And I believe we have the applicant calling in as well.
We do. We didn't open this one up to public comment after the council comments.
Okay, I'm sorry about that. I thought I opened public comment, closed public comment.
I don't think we offered it to the people out there on the phones and the email.
Okay. Okay, we will, I'll open it up now. Is it now a good time can we open it up to public comment now? Yes. Okay. Let's open this item up for public comment. Thank you for that, Bob.
Yep.
Phone number is 916-774-5353. And you may send an email into publiccomment@roseville.ca.us. I know we're on a bit of a delay, but let us know if you get any comments or phone calls, Megan.
Okay, we do have one comment. You can go ahead and state your name and proceed with your comments.
Good evening, Mayor Bernasconi, council members. This is Chad Roberts on behalf of Moyer Investments LLC. I don't have anything to add to Kenny's report at this time, but we did want to take a moment to thank staff for all their hard work in getting this project before you this evening. If you have any additional questions, I'm happy to answer them. If there are no questions, thank you for your time, and we respectfully request you adopt staff recommendations.
Thank you.
Thank you. Any other comments for Steve?
I don't believe we have any other calls or emails at this time, Mayor Bernasconi.
Thank you. Okay, I will.
Yeah, Mayor Bernasconi, if I could just make a very brief comment.
I'll close public comment and go for it. Vice Mayor Haudashelt.
Yeah, I think this is an excellent example of how forward-thinking the city of Roseville is. These amendments are related to groundwater banking, water conservation goals, and recycled water facilities. And in a year in which we are desperately short of water, there could be nothing more symbolic about how proactive our building community and our staff is about addressing this. So just wanted to make that comment.
Mayor, I'd add one more too. In this, it also mentions our transportation and our roadways and a plan between all the developers of how to make sure that it's complete. And also with the water infrastructure on how to make sure that we're complete and how that specific plan there is intact. So I'm real pleased that we all could work together for that common goal of making sure our community has the resources we need.
Thank you. Any other comments? Okay, I will close the public hearing and ask our city clerk to please read the motion for us.
I will summarize what was stated before to adopt the 5 findings of fact, to introduce the ordinance for a second amendment of the development agreement between the city and Moyer Land Investments, and to authorize the city manager to execute it on behalf of the city of Roseville.
So moved.
Second.
Vice Mayor Haddishelt,
Yes.
Councilmember Albert,
Yes.
Councilmember Rakucci,
Yes.
Councilmember Mendoza,
Yes.
and Mayor Bernasconi.
Yes. Thank you. Okay, now we will hear item 10.2, Sierra Vista Specific Plan Development Agreement Amendment.
Good evening, Mayor Bernasconi and council members. My name is Shelby Vaughel, Associate Planner, and I have a presentation for you on the First Amendment to the DF Properties Development Agreement within the Sierra Vista Specific Plan. The DF Properties Development Agreement, or DA, is another one of the 9 DAs governing Sierra Vista Specific Plan area, and the current request is for the First Amendment of that DA. Next slide, please. The request includes several changes to the development agreement. The first modification is to incorporate the modified RSDS development standards for the small lot tentative subdivision map for large lot parcel DF20, which was evaluated concurrently with the proposed amendment and approved by the Planning Commission on November 20th of 2020. These modifications also include provisions for smaller lot sizes and will make the DF Properties DA consistent with other DAs in the Sierra Vista Specific Plan. The second modification is to amend the requirements and responsibilities for frontage improvements along Finament Road. This mirrors the language that you heard in the presentation made by Kinney just a few moments ago, so I won't go into too much detail here, other than it differs in if the southern segment is built along DF42 first, then the signal at San Fernando would be constructed. Ultimately, this modified language clarifies the construction timing and responsibilities and will facilitate construction of the roadway. The amendment also proposes changes to the affordable housing obligations on parcel DF20. At the time of specific plan adoption, DF20 was anticipated to be developed with 113 units. The approved tentative map for DF20 has a total of 103 units, and the number of middle income purchase units was reduced from 5 to 4. Overall, the DA includes an obligation to provide 18 affordable rental units, with 9 for low and 9 for very low income households. This will be consistent in the amendment. One of the major changes to the affordable housing section pertains to the transfer of the affordable housing obligation. The original DA required that any transfer of obligation be limited within the Sierra Vista plan area. The modification would allow the obligation to be transferred within the specific plan or within the infill area of the city. This allows more flexibility and for the developer to credit affordable units to other properties that they own. Further, the revision to this section requires that the developer enter into an affordable housing agreement prior to the recordation of the DF20 map, maintaining that the units be rented only to qualified affordable households for 55 years. This also eliminates all language regarding carriage units, which were defined as living areas above garages. The original DA allowed these units to be counted towards the affordable obligation, and this language is replaced with a requirement to provide the 18 units either in the Sierra Vistas plan area or within the infill area of the city. In conclusion, the proposed modifications to the DA will update the development standards for the tentative map approved by Planning Commission for parcel DF20, clarify responsibility and reflect current timing for the construction of frontage improvements on Finament Road, as well as update affordable housing language and requirements. The proposed development agreement amendment is consistent with the objectives and policies of the city's general plan, Sierra Vista specific plan, and zoning ordinance, and the request is in conformance with the needs of public health, safety, and welfare, and will not adversely affect the orderly development of properties or the preservation of property values. On November 20th, 2020, the Planning Commission unanimously recommended that the City Council consider the 5 findings of fact and introduce for first reading an ordinance approving the First Amendment to the DF Properties Development Agreement relative to the Sierra Vista specific plan. That concludes my presentation, and I'm available to answer any questions. Thank you.
Thank you very much. I will now open it up for a public hearing. And does the council have any comments or questions regarding the presentation?
You know, Mayor Bersconi, I just had a question. This parcel, is it like looking to be developed real soon? I mean, I know you can't tell, but are they working on it? I guess my question is, if you're changing maybe some of the densities, would it be significant for the neighbors that are around them, or, you know, are there neighbors around them?
So we did approve a tentative subdivision map for 103 units in November of 2020. That is consistent with the approved land use, so it won't be changing the densities or anticipated development, but I don't know the timing on the construction.
Okay, as long as it's pretty consistent what people you know, think it's going to be there. So that's what I want to know. Thank you.
Any other questions of Shelby?
I have one, and that is an area that's currently nothing's out there right now. So the property for the affordable housing, I just wanted to clarify, that's property that they already own in another area. Correct. That was my understanding when we went through the presentation before. So they actually own property that they're willing to put on this 55-year affordable housing timeline.
That is the intent of the modification. And essentially what we would be getting out of this is they will be entering into those 55-year contracts prior to recordation of the map for DF20. So we'd be getting those contracts before they can build.
Thank you.
Any other questions? If there are no other questions, I will open this up to public comment. The call-in number is 916-774-5353, or you can send your email to publiccomment@roseville.ca.us.
And we do have a call from the applicant, Mayor Bernasconi.
Thank you.
Hi, Nick, you can go ahead and state your name and proceed with your comments. Go ahead.
Mayor Bernasconi, members of the City Council, Nick Alexander, 1700 Eureka Road, on behalf of DF Properties. We want to thank staff for their efforts on this development agreement amendment and the affordable housing development agreement. Also like to thank Vance Jones of McCann Somps for his efforts. We have read the staff report and the development agreement amendment and are in agreement with its contents, and we respectfully request your approval. And if there are any further questions, I'd be happy to answer them at this time.
Thank you, Nick. And we don't have any other calls or emails at this time.
Okay, thank you. There are no other calls or emails. I will close public comment and ask my colleagues if they have any other questions, comments regarding this item before we move on to closing the public hearing.
No, not for me.
Okay, I'll close the public hearing, and if there are no other comments, Sonia, would you mind reading the motion, please?
The motion is to adopt 5 findings of fact and introduce for first reading an ordinance of the Council of the City of Roseville adopting a first development agreement by and between the City of Roseville and DF Properties relative to the Sierra Vista specific plan, and authorize the city manager to sign it on behalf of the City of Roseville. May I have a motion?
So moved.
Second.
Vice Mayor Haudashelt,
Yes.
Councilmember Albert,
Yes.
Councilmember Rakucci,
Yes.
Councilmember Mendoza,
Yes.
and Mayor Bernasconi.
Yes. Thank you. And that is almost the last item on our agenda. We'll move on to council reports and public comments. And we'll open up for one last time for public comments. So if there is anyone who would like to address the City Council on an item that is not on the agenda, now is the time to call in at 916-774-5353 or submit your public comment at publiccomment@roseville.ca.us. Are there any comments or emails at this time?
We have not received any further public comment.
Okay. I will close public comment. And first, our city manager, are there any other staff reports or anything to update us on? Anything further?
No updates and no further staff reports this evening, Mayor. Thank you.
Thank you. And for our council members, I will start with, or maybe we'll try and do alphabetically. Councilmember Albert, would you like to make any comments?
After looking at that very long list of council assignments and the way the 5 council members have divided that up, it's a little bit exciting, and as we're all starting to roll up our sleeves now and get into all the different boards and commissions that we serve on, and I'm excited. I don't know if the community always realizes that the members are very busy outside of just these council meetings that they see, and I'm excited that we're all representing Roseville. It's nice to have the experience out there on all these different boards and commissions representing our city and trying to help make the best decisions for where we live. Looking forward to reports coming up after this.
Thank you for that. Yes, it's not our 2 meetings a month. Okay. Vice Mayor Haudashelt, do you have any comments this evening?
Yeah, no, building on Councilmember Albert's comments, we will be very busy and we will be driving around and, we won't be going virtually forever. Councilmember Rakucci and I serve on the Regional Water Authority, and as a testament to the proactive partnership that the city of Roseville has with many of the other jurisdictions in the region, our Director of Water Resources, Sean Bigley, was elected as chairman of the executive committee of the Regional Water Authority last week. And he did, and I'm sure our water resources staff collaborated on this, but did a very nice memo on, we like to call it a dry year. We're hoping for a fabulous February and a miracle March, because right now Folsom, which operates as a flood control facility, largely flood protection, is very low. And we desperately need some rain so we could fill up the sites project when it comes on board down the road. But not only are we doing groundwater banking, and there's a test well being drilled right now by Bensel Brown Elementary or Bensel Brown Park, by the baseball field, to see if the water quality there and the water levels would warrant groundwater banking there. So we're being very proactive. I think, when I was going through orientation, Rich Plecker said, I asked my staff to envision a day in which Folsom doesn't exist. How are we going to provide water to a growing city? And as Councilmember Albert said, I'm counting 1, 2, 3, 4, at least 4 meetings next week that are on behalf of the city, and looking forward to rolling up my sleeves and and participating in that. So.
Thank you for that. Councilmember Mendonça?
Thank you, Mayor Bernasconi. I'd be remiss if I didn't also echo Councilmember Albert and Vice Mayor Havishelt's comments. I'm excited with my appointments outside of my 2 meetings a month, and I look forward to engaging with the community. I'd also like to, ask our community to keep the men and women, the officers, and the Sacramento Sheriff's Department in their prayers. They suffered a tragic loss a day or two ago. One of their deputies, as well as one of the canines, and those of us in law enforcement know it's never just one loss to one department. A loss in one department is a loss for all of us in the law enforcement community. So please keep them in their prayers as they grieve during this time, and looking forward to getting some good work done within our own community. So thank you.
Thank you. Councilmember Rakucci?
I was going to mention something. Maybe you've seen in your mail. I'm just going to put it up. It's our Park, Recreation, and Library magazine that came in the mail. And I want to thank our department head, Jill Geller, and her staff for putting it out. It's not only, it really is parks and recreation and library. And so you can see things from all the golf courses we have, the walking trails, the 79 parks where they are, and the different activities you can actually sign up for, but it is very comprehensive, and you can see Roseville in a nutshell of all the activities we have. They talk about the new parks and our existing parks that we've had forever, and we're so grateful. We had a beginning and we have a continuum, but this was very, very exciting. If I was a new person and looked at this book and saw what we had, and I'm a person who's been here a long time, and I'm very excited to see what we have. And it was laid out real well for any age group, and it's great. And as you said, of the committees and things we're doing, we're also working with our community to make sure we keep our city safe and healthy, and so we can enjoy our amenities that we have. That's it.
Thank you for that. Yes, mine came earlier this week, and
yeah, it's wonderful.
Pretty cool to thumb through it. So I think it just shows just one more time how creative our staff is in these times. Just a few things to report on. I know we thanked our the interim health officer before, but I think that they're doing a great job considering the unpredictability that we're getting from at the state level. And so I just wanted to thank their team again for the information that they provided tonight. And they also allow a call Friday afternoons with city managers and the mayors to help ask clarifying questions. So at any point, if my colleagues have any questions that they would like for me to ask on our behalf, I would be happy to do that and to convey the information back to you. I'll continue with SACOG tomorrow. We have a board meeting tomorrow at 9:30 virtually. And I had the pleasure yesterday morning to swear in the new chamber board members. So I wanted to wish them all the best in the advocacy work that they do for our business community. And I know we work closely with the Chamber of Commerce too. So congratulations to those business leaders. That wraps up my comments for this evening. So unless anyone else has anything that they would like to add, can we have a motion to adjourn tonight's meeting, and we will be back February 3rd.
Move to adjourn till February 3rd.
Second.
All those in favor say yes.
Aye.
Aye.
Okay. Thank you, everyone, for your flexibility tonight. We made it. Thank you, Sonia.
Thank you.
Okay.
Bye, everybody.
Okay.
Night.
Night.
Night.